Good afternoon, everyone, and welcome to the second in our series of webinars on the impact of climate change on sustainable economic development in Latin America and Nicaragua. My name is Jody Nicola. I'm the Executive Director of Sostenica, the host for this webinar series. Sostenica integrates educational and environmental programs with financial services, a holistic approach necessary to address the root causes of poverty in rural Nicaragua. We've been active there since the 1990s, working primarily with rural agricultural communities. While we are not a healthcare organization, we are deeply concerned for the well-being of our families and very focused on the impacts of a changing climate. And we are very happy to have Dr. Robert Dubrow with us this afternoon. Rob is uniquely qualified to discuss today's topic, protecting public health in a changing climate. He is a professor of epidemiology at the Yale School of Public Health and the faculty director for the Yale Climate Change and Health Initiative. Much of his teaching and research is now focused on the intersection between climate change and health. Rob is one of the early supporters of our work in Nicaragua. Rob, thanks again for sharing your time with us this afternoon.
The adverse health effects of climate change that we've observed already and also that we anticipate as climate change evolves are really multifaceted and multidimensional. And in the next 20 minutes or so, I'll go through what a number of these dimensions are. Okay, and also before I get started on going through specific adverse health impacts of climate change, I want to emphasize the concept of vulnerability. And so this is from the latest major report of the Intergovernmental Panel on Climate Change, the fifth report. They put out reports every 5 or 6 years or so, these major reports. And so risks of climate change are unevenly distributed and are generally greater for disadvantaged people and communities in countries at all levels of development. Not surprising, but I'm going to try to emphasize the concept of vulnerability as I move through this. Okay, so first, heat waves. So here's a situation of high vulnerability to heat waves. This was a heat wave that occurred in Pakistan back in 2015. So first of all, this man is vulnerable because he's elderly. Turns out that for physiologic and other reasons, elderly people are more vulnerable to the adverse effects of heat stress than younger people are. Also, this man most likely has no access to air conditioning, and air conditioning is a major protective factor against adverse health effects of heat stress. So he's high vulnerability. And here's a situation of lower vulnerability. So these people, also elderly, somewhat elderly people, are in an air-conditioned room. So it could be the exact same heat wave, exact same temperature and humidity in both places, but because of the access to air conditioning, these people are much less vulnerable. Now, notice that I say lower vulnerability, and that's on purpose. I don't say that they're invulnerable to heat waves. And why is that? So here's a quote from the New York Times, an article in September 2017, 8 dead from sweltering nursing home as Florida struggles after Irma. The first patient was rushed into the emergency room of Memorial Regional Hospital around 3 a.m. on Wednesday, escaping a nursing home that had lost air conditioning in the muggy days after Hurricane Irma splintered power lines across the state. Another arrived at 4 a.m. After a third rescue call around 5 a.m., the hospital staff was concerned enough to walk down the street to check the building themselves. What they found was an oven. The rehabilitation center at Hollywood Hills needed to be evacuated immediately. Rescue units were hurrying its more than 100 residents out. In all, 8 were dead. So, not invulnerable. There was air conditioning in this rehabilitation center, but it was vulnerable to the electricity going out due to in this case, to Hurricane Irma. Also, I'll mention, it turns out that during heat waves in places that have a lot of air conditioning, air conditioning places a tremendous stress on essentially on the electric system itself, increasing the danger of power outages. Okay, so of course heat waves occur all around the world, including in Central America. And so it's another newspaper article from 2017. A heat wave is scorching a good portion of Central America, raising temperatures above 40 degrees centigrade or 104 degrees Fahrenheit in some areas. Although this is a time of year when it's usually hot, the desperation among the public is palpable on the social networks, while scenes of people out on the streets bathed in sweat have become commonplace. The drastic change in the weather has caused the incidence of respiratory diseases to skyrocket, mainly among children and the elderly. Again, the vulnerability issue. Okay, so I've been talking about heat stress in general. Now let's focus on occupational heat stress, which is a particular concern for outdoor workers. And here's the situation of high vulnerability. These men are sugarcane harvesters in Nicaragua. It's very hot and humid, and sugarcane harvesting is very demanding physically. So that places additional stress on the body. So there's a particular health concern in this case, which is called Mesoamerican nephropathy. So this is a chronic kidney disease of unknown origin. Most kidney disease is related to diabetes or hypertension, or in some cases, other known causes. So people with Mesoamerican nephropathy do not have diabetes, they do not have hypertension or other known causes. And an epidemic of Mesoamerican nephropathy emerged in Central America over the past 20 or 25 years or so. It's also, the condition has also been observed in other hot regions of the world, such as Sri Lanka, India, and Egypt, and it's predominantly seen in young, that is aged 30 to 50 years, male sugarcane harvesters around the world, although other people develop the condition as well. And it's not an insignificant epidemic, with the estimate being in Central America alone more than 20,000 deaths thus far. So this shows the site of the epidemic. It's along the Pacific coast of Central America. And here's the hypothesized mechanism. And I'll stress that this is still a hypothesis, although there's increasing epidemiologic and other types of evidence in favor of this hypothesis. So we start with heat stress from the combined effect of extreme heat, humidity, and labor. That causes both dehydration and muscle breakdown, both of which are bad for the kidney. So we see acute kidney injury. And over time, with this happening day after day to sugarcane harvesters, this develops into chronic kidney disease. Now, it's also hypothesized that the condition is multifactorial, and two of the leading candidates for other factors are non-steroidal anti-inflammatory drugs and glyphosate herbicides. So non-steroidal anti-inflammatory drugs are, most of you are familiar with these drugs. Drugs like ibuprofen are used for aches and pains. And so these sugarcane harvesters have a lot of aches and pains from working all day out in the fields. And so they take a lot of these drugs, which are toxic to the kidney. And the glyphosate is a commonly used herbicide on the sugarcane fields. You've probably heard of Roundup. That's what glyphosate is. And that also could cause damage to the kidneys. So this is the hypothesis. And how is this related to climate change? Well, as in other parts of the world, it's getting warmer in Central America, which would place even more heat stress on these workers. So to conclude with this topic, here's a situation of lower vulnerability to occupational heat stress. And this was, again, in the sugarcane fields, this time in El Salvador. But some investigators performed what they called a water rest shade intervention, where throughout the day, there were rest breaks for the workers, shade was provided, and substantial water was provided. So you could see the camelbacks that are being worn with the water. Okay, so now let's move on. So here's a situation of high vulnerability to tropical cyclones or hurricanes, and that is Hurricane Maria in Puerto Rico that led to roughly 4,600 deaths. Now, Puerto Rico is a textbook case of vulnerability. It was just, an accident waiting to happen with the poor infrastructure that had been developed over the years in Puerto Rico. And one thing that's really worth noting is when these deaths occurred. So most of them, the vast majority, were not during the hurricane itself. In fact, you might remember that for a long time, the official estimate of number of deaths was only 64. But the vast majority of the deaths actually occurred in the weeks and the months after the hurricane. And a good portion of those were due to disruption of medical care. So if you remember, the electricity, the transportation, the communication, the water, all of those infrastructures were decimated by the hurricane and took in weeks, and for electricity, really months and months to be restored. And there are still problems with electricity. But what does that do to medical care? So people who depended on dialysis, had kidney problems, depended on dialysis for their survival, couldn't get their dialysis. People getting cancer treatment couldn't get their cancer treatment. People who needed drugs couldn't get their drugs. The pharmacies were closed, etc. So the disruption of medical care was a huge problem. Now, Hurricane Harvey was a hurricane that really was on the same order of magnitude in its destructive power as was Hurricane Maria. But here we have a situation of lower vulnerability in Texas and Louisiana, where there were only 82 deaths. And not that, there are problems in infrastructure in Texas and Louisiana, but they're still were in much better shape coming into the hurricane than was Puerto Rico. Okay, continuing with this theme, high vulnerability to waterborne diseases. We're again back to Hurricane Maria. And so, as I mentioned, the water infrastructure was also destroyed. And so people need water. So here you see people collecting water from a canal that is obviously does not have clean water. And so they're subjecting themselves to the possibility of waterborne infections. On the other hand, back to Hurricane Harvey, this is from a Houston news website. Houston drinking water remains safe. Some residents asked to conserve, city says. West District Turkey Creek wastewater treatment plants damaged. So the situation wasn't perfect, but it was far superior to the situation in Puerto Rico. And so waterborne infections did not become a major concern as a result of Hurricane Harvey. Okay, so now let me turn to vector-borne diseases. These are diseases that are carried by mosquitoes and ticks, other types of insects. Some of the main ones of concern are malaria, Lyme disease, chikungunya, Zika, dengue, and so why are we concerned about vector-borne diseases? So it's actually quite complicated when you start studying it scientifically, but the simple answer is that mosquitoes and ticks do better when it gets warmer. And so that's what's happening around the world. And so there's a concern about these diseases both increasing their incidence where they're currently found and also spreading to new areas. And this slide shows the incidence of dengue, which is carried by a mosquito. And you could see that here's Central America, and you can see that it's purple. And so the green on this slide means low incidence, and the darker purple it gets, the higher the incidence. So Central America is among the higher incidence areas for dengue. Okay, and here's the mosquito that carries dengue, the Aedes aegypti mosquito. Okay, another health concern is wildfires. So as you know, the 2018 wildfire season in California was unprecedented. It culminated in the Camp Fire in November, with Paradise being the main victim of the Camp Fire, with at least 85 deaths and 14,000 homes destroyed. Now, when homes are destroyed, that creates health issues. When people, you might remember some of the scenes from Paradise with people sleeping out in the open in parking lots, and you might recall that a vast number of the people who lost their homes were retirees, so were elderly people. So this was very hard on them. A lot of health concerns. They had the same issues with disruption of medical care that I mentioned that happened in Puerto Rico. And there were also long-term concerns with regard to post-traumatic stress disorder and mental health. If you remember, a lot of these people had to flee their homes within minutes in order to survive. That was very traumatic. They came out with nothing. Back to the medical issue, they left their medications. They didn't take their medications with them. Obviously, they didn't have time to grab them. So there were a lot of health issues related to this, including air pollution. So when these wildfires produce a tremendous amount of air pollution, especially particulate matter, which is one of the worst forms of air pollution. And it doesn't just stay right over where the fire is occurring, it spreads around. So this is from November 16th, 2018. You can see in California that a large portion of the state, and the Camp Fire actually at that time wasn't the only fire, there were several fires burning there. But you could see that a large portion of the state had unhealthy air, very unhealthy air, or even hazardous air. Okay, and forest fires or wildfires occur in Central America, including Nicaragua. This was in April 2018. Fires have consumed 1,488 hectares or 3,674 acres of forests in the western province of Chinandega and in the Caribe Norte region, where Hurricane Felix toppled millions of trees when it made landfall on September 4th, 2007, providing fuel for the blazes. So wanted to bring this one up because I don't know, just because there was a drought and a dry season in April 2018 in Nicaragua doesn't mean that it was caused by climate change. So everything isn't caused by climate change. It might have been. There are ways to try to look into that. But I wanted to bring up this millions of trees toppled by Hurricane Felix, which was a Category 5 hurricane. And we know that Category 5 hurricanes are becoming more common due to climate change. And apparently the toppling of these trees contributed to these fires that occurred 11 years later by providing this, dry timber that would be fuel for the fires. So this could be related to climate change in several ways. All right. So now, climate change, agricultural failure, food insecurity, and migration are intimately connected. So let's go into that a little bit. So here's a very recent article from the Washington Post, how Trump's border crisis is driven by climate change. Central America, where a third of all jobs remain linked to agriculture, is one of the more susceptible regions in the world to the long-term effects of a warming planet. Successive years of drought, extreme fluctuations in temperature, and shifting rain patterns have led to failed harvests and forced many Central American farmers to forsake traditional crops. Conditions are particularly acute in the highlands that link central Honduras to western Guatemala, where millions of subsistence farmers have seen their livelihoods ravaged, not just by lack of rain, but also its excess, floods, landslides, and hurricanes. Their plight has been compounded by woeful agricultural infrastructure and national governments that have few resources to help them. In 2016, the United Nations Food and Agriculture Organization estimated that at least 1.6 million people in Central America faced constant food insecurity because of climate change. In 2017, the survey of Central American migrant families conducted by the World Food Program found that nearly half had left their country because of a lack of food. Now, migration is always complicated, and so no one would say that climate change was the only cause of Central American migration to the United States, but I think a pretty good case, because of, we know about other causes. There's the violence that's occurring in parts of Central America, there's the poverty, etc. But I think a pretty good case could be made that climate change is a contributing factor to a very complex issue. So here's a situation of high vulnerability to food insecurity and other adverse health outcomes. So I'm sure most or all of you remember this scene in El Paso in March, where migrants were being held under this bridge, obviously in not in very good conditions. So a lot of these people probably migrated to begin with due to food insecurity. Now they're here in an unhealthy situation where they're probably at increased risk for infectious diseases, for example, and other health issues. They're not don't have access to the healthcare that they need, etc. Okay, so here's a situation of lower refugee vulnerability. This is back in 2015 when Germany had very progressive immigration policies, and here you see this woman and her children waiting to ask for asylum in Germany. Okay, so before leaving this overview of the adverse health effects of climate change, I think it's worth emphasizing the mental health effects, which have been understudied but are starting to be more appreciated. Because we have all these situations with climate change and extreme events where people lose their homes, they lose their livelihood. It's very stressful. It's very stressful, as I mentioned, of course, going through a wildfire, or for that matter, going through a Category 5 hurricane, especially if you lose everything as a result. And so there are a lot of mental health issues. This has been studied actually somewhat in the aftermath of Hurricane Katrina, and studies showed quite significant effects. Okay, so now, thinking of this in a public health lens, what are the public health strategies to reduce health risks of climate change? And it's really two. The first is mitigation, which from a public health perspective, we would call primary prevention, or getting at the root of the problem. The root of the problem being human emissions of greenhouse gases. So mitigation is interventions to reduce greenhouse gases or to enhance greenhouse gas sinks, such as reforestation. And the second public health strategy is adaptation or secondary prevention. So adaptation is saying that we know that climate change is happening and will continue to happen and is causing adverse health effects, and those health effects will get worse as climate change continues to happen. So we need to have interventions that will address that and reduce our vulnerability to those adverse health effects as a result of climate change. Okay, so just to make that concrete, here are a few examples of adaptation. So first, for food insecurity, we might work on changing crop varieties, locations, and planting schedules. For heat extremes, we might plant trees and increase green space in cities to reduce the urban heat island effect. And to remind you, we already talked about occupational heat stress and the water rest shade intervention. Okay, so this is an important figure, so let me go through it in a bit of detail. The x-axis is year from 1850 and is projecting out to 2300. The y-axis is average global surface temperature change in degrees centigrade. Okay, and this is taken from the last major IPCC, Intergovernmental Panel on Climate Change report. And if we wanted, they were trying to project what's going to happen in the future and with regard to average global temperature. And to do that, you need to make an assumption about what humans are going to do with regard to greenhouse gas emissions, because that's the main driver of increased temperature or not. And so they developed 4 different, what they called RCPs, or representative concentration pathways, which are essentially greenhouse gas emission scenarios. And let's just focus on the 2 extreme ones. So the RCP 8.5 is the business as usual high emission scenario. So that's saying we're really not going to, the world really won't do any much about climate change in terms of mitigation. We'll just keep it emitting as we're emitting. We'll keep developing fossil fuels, keep burning fossil fuels. The RCP 2.6, on the other hand, is an aggressive mitigation scenario where we would take mitigation very seriously and do it very aggressively, like, for example, the Green New Deal. And so you can see that with the RCP 8.5, by 2100, which is a year people often point to, we see a 4 degrees rise in temperature over the baseline of 1986 to 2005. That's about 7.2 degrees Fahrenheit. So that's a pretty big deal. And of course, the world doesn't stop at 2100. So if you follow that out all the way to 2300, it's about an 8 degrees centigrade rise, which is almost unimaginable. On the other hand, with the aggressive mitigation 2.6 scenario, you could see that, we do much better. And you could also see the wide divergence between the 2 over time. And so this actually, is hopeful. It says we still makes a lot of sense to take aggressive action, although we no longer could do as well as is shown in this graph, because notice that the scenarios start around 2005, and of course we haven't started with an aggressive mitigation scenario yet. Okay, so if we follow along with the RCP 8.5, the business as usual scenario, it's important to recognize that there's really limits to adaptation. We can't just do business as usual and think that we're going to adapt and everything will be fine. If with business as usual, eventually maybe 2100 and maybe 2050 and maybe 2200, but parts of the world will become uninhabitable. Rapid sea level rise, and there will be rapid sea level rise, and we'll see abandonment of major coastal cities like New York, Miami, Dhaka, etc. There will be severe reductions in labor productivity and severe global food insecurity. So we really need to do aggressive mitigation. So how are we doing with mitigation? So this shows global fossil CO2 emissions from 1990 to the present. And you can see that we're not doing very well at all with mitigation. There's really been a steady rise. You could see a slight downturn during the Great Recession for just a year. Then people were somewhat hopeful during this period that things were leveling off, but now we see another upturn that's occurred. So we haven't been doing very well. And the IPCC issued a special report last year that a lot of you probably heard about. And it talked about what we need to do to limit warming to 1.5 degrees centigrade versus 2 degrees centigrade. And for 1.5 degrees centigrade, we need to see a 45% decline in greenhouse gas emissions from the 2010 levels by 2030. So that's quite a lift, and net zero around 2050. To limit warming to 2 degrees centigrade, it's a 20% decline in greenhouse gas emissions from 2010 levels by 2030, and net zero around 2075, which is also a big lift. And the motivation for this report and for doing these calculations was the Paris Agreement, where 1.5 degrees centigrade was set as an aspirational goal, and 2 degrees centigrade was set as kind of a hard goal. Hard by hard goal, I mean the goal that the world has really agreed. This is, we can't go past 2 degrees centigrade. All right. So you're probably pretty aware of what we need to do for climate change mitigation, but let me just catalog here the main measures that are important. So of course, the most important one is a rapid transition from fossil fuels to renewable energy. We also, energy conservation and efficiency could also go a long way. Active transport is important. That is walking and cycling and public transportation instead of the individual automobile. Forest and soil management to increase carbon sinks, and shift from animal toward plant agriculture. That is mainly to reduce methane emissions. Methane is the second most important greenhouse gas. Okay, so back to this. So notice that in the first few decades after, suppose we were to start an aggressive mitigation scenario here. Notice that in the first few decades, there's not that much of a divergence between any of these scenarios. And the reason for, but we see increased warming, which would mean increased adverse health effects. And the reason for that is twofold. That first, even if we had a Green New Deal to reduce emissions, it would take several decades to fully accomplish it, or even if it takes it just, even like in terms of what's being proposed by AOC, even if we're 12 years, it would still not be accomplished instantly. And secondly, and importantly, there's a phenomenon called thermal inertia, such that even if we stopped all emissions today, we're basically committed to another ½ degree centigrade of warming from greenhouse gases that were already emitted. So it takes several decades when greenhouse gases are emitted to equilibrate to a new temperature. All right, so because of this, so we're going to see increased warming no matter what, which means we'll see increased adverse health effects. And so there are few immediate health benefits that result directly from reducing greenhouse gas emissions. It's going to take time before we really see a benefit. So that's a bit of a problem because, we're telling people we really need to do this, really need to reduce emissions, and then the health effects will be getting worse. But there's a silver lining, and it didn't have to be this way, but it turns out that there are immediate health benefits of climate change mitigation that are totally independent of the effect of reducing the greenhouse gas emissions, such that even if climate change were not occurring, these measures would represent critical public health interventions in their own right. So they should be done even if climate change were not a problem. So let me get concrete, and I think you'll see quickly what I'm getting at here. So if we decrease fossil fuel burning, we decrease greenhouse gas emissions. That has no immediate direct effect on health, but we do immediately decrease the emissions of toxic air pollutants, such as particulate matter, that kill and air pollution literally kills millions of people every year. So that's a major immediate benefit of reducing the burning of fossil fuels. Okay, if we increase infrastructure for bicycling, we get cars off the road. That reduces greenhouse gas emissions, but we also increase physical activity, which is one of the best things we could do for public health. We decrease air pollution again because there are less cars on the road, and we increase mental health because there's a link between increased physical activity and increased mental health. Okay, if we shift from animal towards plant agriculture, we decrease the methane emissions, as I mentioned, but that also results in a healthier diet because a plant-based diet is healthier than an animal-based diet. And especially, actually, in this case, in the developed world, where people on the whole eat much too much meat for their health, this would lead to greater health. Okay, the fourth example. So most of you are aware, some of you may not be, that in large parts of the world, women, and it is women, cook with essentially dirty cook stoves that produce a lot of indoor air pollution. And so if we switch those from inefficient, dirty cook stoves to clean, efficient cook stoves, that, as I'll point out in a little more detail in a minute, helps with climate change because it helps prevent deforestation, and it also decreases the air pollution that you see on the left here. So here's a dirty cook stove, here's a clean cook stove. Okay, so let's go through that in a little more detail. So these inefficient cook stoves use solid fuels. Wood is the most common, but also charcoal, which is derived from wood, coal, and dung are used. Generally, but not always, they're three-stone open fire stoves, and they often have no chimney, so there's no venting of the smoke to the outside. These cook stoves are still used by almost 3 billion people, including many people in Central America. They account for 2.6 million deaths per year worldwide due to the indoor air pollution. And as I alluded to before, the climate effect is deforestation from unsustainable wood harvesting. And that unsustainable wood harvesting is happening in many parts of the world, including in parts of Central America. Okay, so what's the essential lesson? So first, climate change mitigation is absolutely essential to protect our health and that of future generations. Simply adapting business as usual just isn't going to do it. We really need to mitigate. We have to do it now. We have to do it very fast. Secondly, most direct health benefits, and mitigation is a public health measure. It would do great things to improve public health. Secondly, most direct health benefits of reduced greenhouse gas emissions will not start accruing for several decades. So reducing greenhouse gas emissions will have tremendous public health benefits in the long run, but they're delayed. Fortunately, climate change mitigation has major immediate health benefits separate from the delayed benefits of reducing greenhouse gas emissions. And I and others would submit that these immediate health benefits have been underemphasized and that they need to be emphasized more to build public support for mitigation. So I like to end with this slide. So what if it's a big hoax and we create a better world for nothing?
Rob, that's great, and a nice dose of humor at the end. Thank you for that fantastic overview.
Sure.
I'd like to just remind the audience that there is at the bottom, if you scroll to the bottom of your screen, there's a little toolbar, and you should have the option to ask questions, Q&A button. So if you go there and you click, if you have any questions, I will get those in written form, and we'll then pose those questions to Rob. So please, anything that comes to mind, jot it down, send it over, and we'll see if we can get you an answer. And while you think about that, let me take the opportunity to ask the first question, which is, Rob, what do you see as the climate-related priorities for public health? And would you say that there are any differences based on where you are in the world, so North America versus Latin America, for example?
Right. So the first thing I'd say is what I was trying to emphasize, that mitigation needs to be seen as a public health measure, because it is a public health measure. And that's really primary all over the world. But it has to be done smartly, because you need public support, and unfortunately, in parts of the world that are particularly vulnerable, understandably, climate change mitigation, reducing greenhouse gas emissions when people are struggling to survive from day to day isn't necessarily a top priority. So I think linking climate change mitigation with co-benefits, what people call co-benefits, and I've been focusing on the health co-benefits, but there also is the possibility of economic co-benefits and social co-benefits, et cetera, is really critical. So it can't just be kind of thinking in the long term when, you know, some of us have the great fortune to be kind of have the freedom to be able to think more in the long term, because we don't have those immediate kinds of survival concerns. But for the many billions of people who do, it's really important to link the mitigation to these other kind of immediate benefits.
Okay, that's helpful. And we do have some questions that are starting to come in. So let me switch from my questions to some questions from the audience. And again, these aren't visible directly to Rob, so I'm going to read the question. If it's something that I can answer myself by writing, I will defer that question and address it later on. But let me start with one question. It says, what if we concentrate on addressing poverty because rich people have the ability and freedom to pay for a cleaner environment? So I interpret that as, you know, what could we do that would be directly targeted towards poverty that might have some of these public health benefits that you were alluding to?
Right. So I think, you know, it's really complicated because it, as the questioner, you know, is getting at, it's hard to deal with climate change in isolation, and that's part of the beauty of what of the Green New Deal document that AOC produced. You know, she tried to link all these things because they are linked. But so let me give an example that maybe will be helpful. It's a small example, but it illuminates a few things. There's a cooperative in Costa Rica, a wind farm cooperative, that built a wind farm. They developed kind of a tourist industry around it, where tourists actually come to see this wind farm. The tourist industry provides jobs. Because people come there, they have a restaurant that also provides income and jobs. They developed an environmental program that's also part that when people come, when tourists come, they present them with this whole environmental program that provides even more jobs. And so that's kind of a small example, but I mean, I think, you know, on the kind of micro level, we need to be creative in that regard. With regard to the cook stoves, which is a major problem in poor areas, as I tried to point out, you know, not just in Central America, but also in Asia and Africa and Latin America and South America. That there's an approach that people are taking also of building local businesses, local clean, efficient cook stove businesses that do the, you know, that they manufacture the cook stoves locally, have local workers that install them, etc. So that's another way of addressing, another example of addressing poverty and the climate change issue at the same time, and also with the immediate health co-benefits.
No, I agree, Rob, and let me just add a couple perspectives from where we work in Latin America, and just building on your description of the clean cook stoves, that is an important initiative of Sostenica's as well. And we do see both economic opportunity for small business people to develop a clean cook stove building companies. But we also see that the people most in need are the people that are currently cooking indoors over open fires. They are really the poorest of the poor. And by bringing a vented cook stove, and it may still be using solid fuel, but by bringing in a vented cook stove, it has both health effects and really a whole cascading set of benefits for the family that lead to all kinds of opportunities. And let me give you a very specific example that we ended up building a biogas digester for a farmer who had a fairly sizable pig farm. At the same time, his wife, who is in many of these cultures, the housewife is doing essentially all of the cooking. She wanted a cook stove, so we installed a cook stove at the same time. What they ended up doing is realizing they can use that biogas in the cook stove. And so now they actually are cooking with the biogas that's produced from the pig waste from the pig farm. And this is all part of a broader program that's designed to address poverty, where the programs that Sustanica are implementing are fundamentally about sustainable development, sustainable economic development. And these benefits that are targeted towards poverty are also affecting health, and in particular mitigating some of the health impacts that are associated with climate change that Rob described for us very concisely. And Rob, let me give you
if I can make one more point, at the more macro level along the lines that we've been talking about. So one way to accomplish mitigation that people have proposed is a carbon tax. And that's controversial because if you just have a carbon tax, it's regressive. It affects poor people the most. But there are ways to do it that are not regressive, which would, essentially, without going into details, you could basically collect the income from the carbon tax and distribute it back to people at lower income levels. So that's kind of, in terms of the question that was asked about poverty, that's more on the macro policy level.
Yep, absolutely. I'll give you a break. There's a question here directed to me. It says, in the area where Sustanica works, are you seeing effects of climate change, and what are they, and are there feasible mitigation strategies? I think that the short answer is absolutely seeing the effects, and they range from more frequent heat waves to much more intense rainfall events when they occur, and longer dry seasons and more frequent droughts. This is creating a number of stresses on the communities, rural communities, particularly these agricultural communities that are very dependent on a more predictable weather pattern. Mitigation strategies, essentially what is needed is the ability to manage these extremes, and that ranges from ability to access groundwater for irrigation, to managing your groundwater storage capacity, growing different crops, introducing more drought-resistant crops. So there's a whole range of things that are being introduced throughout Latin America that are necessary to deal with the changes that are absolutely being experienced today. The other perspective I'd want to share is that some of the agricultural practices that are being promoted by Sustanica and others have the dual benefit of not only increasing farm productivity, but they also allow us to store carbon. And that carbon is stored both in above and below ground biomass and in the soil itself. And that's a mitigant, as Rob in his description talked about adaptation and mitigation. These strategies are both. They do adaptation and mitigation simultaneously. So there's a lot of very interesting stuff going on in Nicaragua, Latin America, and the world right now. Bringing us back to the Northeast, I had a question. I work with a conservation district in Connecticut and am planning a climate action symposium for later this year. What specific topics would you recommend be presented or focused on for people in our area? I am thinking what people can do in their own lives, people that said they want to do something but don't know what.
Okay, so in terms of some of the health concerns that are specific to Connecticut, of course, where Connecticut is, sorry, was it Northeast or Connecticut? It was in Connecticut?
In Connecticut, specific
Yeah,
in
okay,
Connecticut.
yeah, specific, yeah. So Connecticut, of course, susceptible to hurricanes and to coastal flooding and all the issues related to those. So I would think that that would be an important topic. And there's actually, the questioner may or may not be familiar with, there's actually a lot of interesting work going on with coastal adaptation in Connecticut. Lyme disease is, of course, another thing to think about. What seems to be happening in Connecticut and the Northeast in general, one of the main effects of climate change is more extreme precipitation events becoming more extreme. So that would be another one to focus on. We've been fairly fortunate in the last few years, I think, in terms of not having like really devastating heat waves, but they're going to come. I mean, it's, you know, it's something we need to be prepared for. What else? And I think, I'm not sure if you had in mind for this conference mainly adaptation issues or mitigation issues, but if you're going to deal with mitigation, I think we really need to figure out ways to push the state government. That's done a decent job, but there are ways we could do better, such as, for example, innovative ways to promote solar energy or to promote electric vehicles. So those are some of the things that come to mind off the cuff.
And I would add, Rob, I think you had a nice slide there on mitigation, personal mitigation strategies that may be relevant to the extent that was going to be a topic in the symposium. So, you know, active lifestyles, change in diet, there's a number of things there that whose benefits have been quantified. There's a lot of resources out there that talk about the where you can link different changes in behavior to changes in greenhouse gas emissions, and there's a lot of useful tools out there for explaining that to people.
Okay, I'm glad you mentioned that, because on the one hand, there's the individual measures that you're talking about, but those need to be facilitated by public policy. And in the examples you gave, you know, the proportion in our transportation budgets, the proportion that goes into building cycling lanes or, you know, pedestrian infrastructure and public transportation, for that matter, is really small compared to what goes into, you know, keeping up the infrastructure for the automobile. And that needs to be shifted to, you know, in order to promote the active lifestyle that you were talking about.
Absolutely. Yep. Okay, we have a couple more questions and about 5 minutes left, so may have a good fit here. So this question is I think a good one, Rob, for you, which it reads: is there a website or a one-stop shop, if you will, which is dedicated to combating myths about health and climate change? Something like a Snopes for Health regarding climate change, or wind turbines cause cancer, or clean coal exists. Do you know of anything like that?
You know, that's I don't, but that suggests actually a good idea. I think it would be a useful website to have, but I don't know of any.
Yeah, I don't either. I know that there are, you know, a lot of very useful tools online for assessing greenhouse gas emission impacts of different practices. There's a lot written generally about climate change. I haven't seen anything that's specifically targets debunking myths or, you know, explaining the truth. Although I think with a Google search, you might be able to uncover something. But I agree with you, Rob. Nothing immediately comes to mind.
Yeah, let me mention though, in case people don't know about them, there are some excellent websites about climate change, and ones that keep very up to date. That they provide daily briefs and stuff like that. One is Inside Climate News. Another one is Climate Central. They're really excellent. They do a lot of good work.
Perfect. Perfect. Okay, another question, Rob, is there research also looking at how global warming is introducing new disease vectors or human biological morbidity and or mortality with respect to harsher cooling events?
To cooling events, right. So
extreme weather events, both on the heating and the cooling side.
So there's a lot of research going on. Well, I shouldn't say a lot. One of the issues with climate change and health research is that there's a severe lack of funding. So there could be a lot more going on. There's virtually no funding from the federal government, for example. Even before Trump, that was true. There's more funding available to European and Chinese investigators. The European Union does a much better job than the United States does, for example, and also China has been emerging as really the world leader in climate change. Now to the specific question, well, first about the cooling part, I assume you're referring to like these polar vortex events that climate scientists are hypothesizing are linked to climate change, although it's still something that's still under active investigation. There hasn't been much done with regard to those in terms of trying to understand their health effects so far, to my knowledge. Another point to make would be that for the most part, and this doesn't mean that the situation won't change, but for the most part so far, what's happened with climate change is that it's made existing known diseases or health issues worse. So, you know, if we think about dengue or malaria or Lyme, like Lyme, for example, is because of climate change is spreading from the northeast United States into southern Canada. But we're not seeing new diseases carried by the deer tick. It's the same disease that's spreading.
Yep. Okay. I see that two of the questions that I have remaining are actually answers to the question asked earlier about debunking myths, and there are two separate suggestions. One audience member suggested an app or a website called Skeptical Science that deals with myths, and then another person mentioned Climate Change Reality Project, and Rob, that may be what you talked about. So Climate Change Reality Project and Skeptical Science are things to look into.
Yeah, thanks to those people for suggesting those.
Okay, well, we are out of time. I did want to, again, thank you, Rob, for a very, very helpful and informative presentation. I think there's one unanswered question, and I will try to respond to that in writing. But again, Rob, thank you for your time, and hope everyone got what they were looking for this afternoon. Thanks for participating.
Yeah. Right, thanks to everyone, and I also hope that you found it to be useful.
Take care, bye-bye.
Okay, bye.